Good afternoon from UNICEF in Acenti, the Global Office of Research and Foresight in Florence, Italy. Thank you so much for joining us today. My name is Gavin Wood, and I'm delighted to welcome you to the second webinar in our series Beyond Barriers, where we will look at opportunities in conducting disability inclusion research. A big thank you to those of you who joined us on Monday for the first webinar, where we looked at early childhood identification and intervention. Children with disabilities, that's 240 million worldwide, remain amongst the most under-researched and underserved populations globally, particularly in low and middle-income countries and humanitarian settings. And despite growing commitments to removing the barriers to inclusion, critical evidence gaps persist, leaving policymakers, donors, and practitioners without the knowledge needed to design effective interventions. So over the coming weeks, we'll be bringing together experts, panelists, and advocates to explore both the challenges and the opportunities in conducting research with and for children with disabilities. In this series, we will explore themes such as access to assistive technologies, research in emergency settings, and today we'll be focusing on exploring preventing and protecting children with disabilities from all forms of violence and abuse. If you haven't done so already, you can still register for the other themes, the other webinars. Please use the link that is shared in the Q&A box just now. Before we begin, I have a few housekeeping notes. Closed captioning is available, and you can enable it via the Zoom settings menu and clicking on the CC button at the bottom of the screen. You should see that international sign interpretation is also being provided thanks to our colleagues at Overseas Interpreting who are supporting us throughout this series. Our thanks also go to Altamont Group, who are leading the curation and facilitation of this webinar series. And they'll be supporting the smooth running of today's session, and we'll also be reviewing the questions during the Q&A. Before, excuse me, before I introduce the session and the moderator, on your screen, there will appear a poll just to get the ball rolling and ask you, the participants, what do you see as the biggest barrier to preventing violence against children with disabilities? Very open-ended, big question, and 4 options. So the first, lack of data. Second, stigma. 3 policy gaps. 4, insufficient funding. So we'll give you a moment just to choose one of those, just to see where we all stand at the beginning of this session. So this will close very shortly, and I'll describe the results on the screen. So the poll is closed. It seems there's very much a 46% of you are saying stigma is the biggest barrier. Of course, you were only allowed to choose one. So you may have also selected, if you had the opportunity, lack of data, which has come second. So 25% saying lack of data. Policy gaps, just under 20%, that's 17%. Insufficient funding coming down at 13%. Stigma being the primary consideration that you are attributing to being a big barrier to preventing violence against children with disabilities. So thank you for that poll to get us going. I'm delighted to introduce our moderator for today's session, Lucy Marie Richardson, a colleague of mine, and she's a consultant for disability inclusive child protection in the child protection program team at UNICEF New York headquarters, working to strengthen the inclusion of children with disabilities across all protection programming areas. Highlights of this role, she has many, but include moderating panels at COSP, the Conference of State Parties to the UN Convention on the Rights of Persons with Disabilities, the CRPD, and also briefings to the CRPD committee. Acting as accessibility focal point for the Committee on the Rights of the Child 2021 Day of General Discussion, and developing resources such as the Framework for Disability Inclusive Child Protection Competencies in the Social Services Workforce and Disability Inclusive Child Protection System Strengthening. So we are in great hands, and I'm delighted to now hand over. Thank you, Lucy. I'm handing over to you for today's webinar.
Great. Thank you so much, Gavin. Hello, everyone, and welcome again. It's really a great pleasure to join you today for this session of the Beyond Barriers webinar series. And our theme today is preventing and protecting children with disabilities from all forms of violence and abuse. So children with disabilities are first and foremost children. They have the same rights as all other children, as children without disabilities, to protection from harm, to a safe and secure environment, and to loving and nurturing care. But for children with disabilities, experiences of violence and abuse are all too common. So a comprehensive review of existing evidence showed that around 1/3 of all children with disabilities are survivors of violence, and that they're twice as likely as their peers without disabilities to experience violence. So some of the other things that we currently know, that children with disabilities are subjected to violence and abuse in all settings, including in their homes, schools, and communities, and in both humanitarian and development contexts. The perpetrators of this violence can be anyone, including their peers, family members, intimate partners, caregivers, and services staff. And they experience the same types of violence and abuse as their peers without disabilities, along with violence directly related to their disabilities. And finally, some of the drivers of this violence that we are aware of are community exclusion and isolation, stigma and discrimination, and lack of inclusive child protection systems and services. But we still don't know enough because there are gaps in the research, and we are still lacking the kind of evidence that could inform our actions to protect children with disabilities from violence and abuse and uphold their right to safety. So we really hope that today's session will be an engaging and thought-provoking conversation on this topic and the challenges involved in its research. So before we get started, I'll provide a brief overview of today's agenda. We have that on this slide on your screen at the moment. We have 3 sessions in this webinar, starting with the welcome and introduction that we're in now. But session 1 will be some short presentations from each of our speakers focused on a specific dimension or aspect of the topic. And then next, session 2 will be a moderated panel discussion of about 30 minutes. So we'll explore some of the key challenges and barriers in conducting research in this area. And then session 3 will be the interactive session of about 30 minutes. We'll open the floor for question and answers, giving you an opportunity to engage directly with our speakers. And then finally, we'll conclude with a brief wrap-up before closing remarks. So we really encourage active participation from everyone. So attendees, you are welcome to submit your questions in the Q&A box at any time, and we'll get to those during session 3 of the webinar. And throughout the webinar, you'll also be invited to participate in a series of quick polls to share your perspectives. So please do contribute to those as well. If you have problems accessing the poll, you can always enter your comments in the Q&A box. So we'll be starting with the short presentations from our 4 very distinguished speakers that we're very happy to have with us today. Each speaker will have about 10 minutes. And so I'll introduce the speakers that we have. So we'll be starting with Emily Eldridge from the London School of Hygiene and Tropical Medicine, working in the International Centre for Evidence in Disability and the Child Protection Research Group. We have Dr. Claudia Aresi, the Global Policy and Advocacy Director at SOS Children's Villages International. We have Dr. Cecile Mersby-Jensen, PhD, Senior Associate Professor at University College Absalon and Head of Research at the Centre for Social Work Denmark. And we have Mariam Asani, CEO of Child Safe Middle East and ISPCAN board member. So first, we're going to be hearing from Emily, and some of what she will cover is some of the key definitions and concepts, and she'll explore a bit further this topic. Over to you, Emily. Thanks.
Thank you, Lucy, and hello, everyone. So as Lucy said, I'm going to start with some definitions and some key concepts. So the UN Convention on the Rights of the Child defines violence as all forms of physical or mental violence, injury and abuse, neglect or negligent treatment, maltreatment or exploitation, including sexual abuse. And the International Classification of Violence Against Children builds on this definition, defining violence as any deliberate, unwanted, and non-essential act, threatened or actual, against a child or against multiple children that results in or has high likelihood of resulting in death, injury, or other forms of physical and psychological suffering. So these definitions are broad and they encompass many different acts of violence, but they also include exploitation and neglect, which is important to the definition of violence against children. So these definitions will be framing our discussion today. Next slide, please. So the social ecological model of violence is one way to think about the risk factors and the protective factors relating to both the experiences of victimization and perpetration of violence against children. And I have a picture on my screen, and the model has several layers that contribute to both these risk and protective factors. So you have the child layer, you have the relational layer, which is the family and caregiver typically in a child's life. You have the community layer, so that could include schools. And then you have the structural layer, so that's policies and systems and cultures and society. So when you apply this to children with disabilities, at the individual level, that can include disability and the intersection with sex. And at the structural level, this can include stigma and discrimination, which may drive violence against children with disabilities. Next slide, please. So estimates suggest that 1 billion children experience violence every year. And the frequency and severity of violence victimization is often greater amongst minority and marginalized children who often unfairly experience social disadvantage or social stigma. Next slide, please. So this includes children with disabilities, and children with disabilities, as Lucy mentioned earlier, are twice as likely to experience violence compared to children without disabilities. And this can be seen in multiple settings. So this can be seen in schools, as one study in Uganda found that children with disabilities could experience high levels of all forms of violence compared to children without disabilities. Evidence from low and middle income countries found that children with disabilities in many of these countries experience higher levels of violent discipline, severe punishment, and child labor compared to children without disabilities. Next slide, please. And experiences of violence and discrimination can vary by impairment and also by socio-demographic characteristics. So a review of studies globally found that children with cognitive disabilities or mental health disabilities can experience higher levels of most forms of violence compared to children with other disabilities. It also found that children with sensory impairments can be bullied more by peers compared to children with other disabilities. And although there is less evidence here, experiences of violence can intersect with sex. So a study in Uganda found that girls with disabilities were more likely to experience sexual violence than girls without disabilities. Next slide, please. And there is often a gap between the number of children experiencing violence and those who decide to report or refer their experiences to wider child protection systems. But children with disabilities may face additional barriers to reporting abuse or to referral services due to both interpersonal and structural factors. So thinking back to that social ecological model that we mentioned earlier. And a study based in Zambia found that children with disabilities often did not report their experiences, and cases were often not addressed if they did report them. And a study in Uganda and Malawi found similar findings and found that some of the barriers included limited accessibility of services and financial barriers to accessing care and disability-related stigma. Next slide, please. So despite this evidence that there is a higher prevalence and that there are barriers to reporting experiences of violence, many violence prevention interventions do not consider disability. So along with colleagues, I conducted a systematic review of all trials evaluating school-based violence prevention interventions. And we found 160 trials, but only 3 of these looked at the effect of the intervention for children with disabilities. And none of these reported meaningful disability-inclusive adaptations to intervention design. Another review in low middle income countries found 20 interventions targeting the reduction of stigma and discrimination. And 90%, promisingly, 90% found an effect. However, most of these had a high risk of bias. I'm now going to share some learnings from the systematic review I conducted, as well as a trial I'm part of that is a mainstream intervention in schools, and we are looking at the effect for children with disabilities. So next slide, please. Okay, so of course with research, we would start with a research question, but I wanted to highlight in particular that if you are a trialist evaluating a mainstream intervention, that you may want to add an additional question looking at the effect for children with disabilities and children without disabilities, but also importantly, looking at the differential effect. Next slide, please. You might want to measure disability in your sample and adapt questions for disability. So include internationally validated measures such as the Washington Group questions or the Child Functioning Model. You could also use a clinical measure of disability. You could consider adding additional questions in your survey relating to children with disabilities' experience of violence. So measuring stigma, measuring disability-targeted violence. Next. You might adapt your sampling and survey design. So you can stratify sampling, or you can oversample children with disabilities to increase your statistical power. So you're measuring the experiences of violence, but then you can actually conduct your subgroup analyses. And then you will consult potentially OPDs and also people with disabilities in the community for adaptations based on context. Next slide, please. You could train your data collectors in inclusive methodology and adapt data collection procedures. So data collectors can be trained to adapt the questions and the location for different impairments, adapt both the consent and assent forms to include witness and thumbprint options, and to include an accessible location of data collection, which can be done in consultation with people with disabilities. So that might be at the participant's home. Next slide. And importantly for violence prevention, you will likely get disclosures of violence, either through the questions you're asking or through the themes that you are talking about in your research. You may have disclosures through those pathways. And so a really important part, as many violence researchers here will know, is creating a referral plan in case of these disclosures. And it's important that when you have these plans, that they are disability inclusive. So in terms of counselling, is there, for example, a sign language interpreter available for children who need it? If it's not possible to adapt these referral plans, considering whether it's ethical to conduct the research. Next slide, please. And finally, if you're a practitioner or if you're a trialist working on formative research before a trial, you might think about some of the intervention content and adapting that. So some things to think about is whether the content addresses the interpersonal, community and structural drivers of violence against children with disabilities. So thinking back to the social ecological model. And thinking about a twin track approach. So programming both the mainstream interventions that are inclusive of children with disabilities, and then also targeted and bespoke interventions to children with disabilities that might explore the structural drivers of violence in particular. Thank you very much, and I'll hand back to Lucy.
Great. Thank you so much, Emily, for setting the stage really clearly there and outlining those elements of research design. And now we will move on to our next speakers. We will have Claudia and Cecile. Claudia will begin the discussion on the Global Report on Children's Care and Protection, and Cecile will continue on the methodological approaches. So over to you, Claudia.
Thank you so much, Lucy. It's a pleasure to be here today to share a few insights from the Global Report on Children's Care and Protection by SOS Children's Villages International. I will first start with a brief introduction, then move into some key findings, and then leave the floor to Cecil to illustrate the participatory methodology and its adaptation to children with disabilities. We will then conclude with a few key takeaways. Next slide, please. SOS Children's Villages International works with children and young people without or at risk of losing parental care in over 100 countries. We conduct family strengthening, alternative care, and advocacy programs to improve care and support for children who live in families in vulnerable situation and at risk of breakdown, as well as we support children who have lost parental care. For this reason, we were particularly interested in understanding why we continue witnessing in research and practice that children are separated from their families, even when it is unnecessary and when it could be possible to prevent it through supportive services that support family-based care. In this respect, we decided to undertake a global research to further investigate the risk and protective factors in child-family separation, but with a specific innovative approach with respect to the existing body of evidence, because we wanted to better capture the perspectives of children, including children with disabilities, caregivers, and practitioners. We wanted to hear from them why separation occurs and how children and adults interpret and cope with it, and also what changes they think would help. So if we move on to the next slide, please. This research project adopted a mixed method approach, meaning that we combine a systematic literature review on the drivers of child-family separation focused on lower and middle-income countries. This was conducted by Brown University, and then with the support of international and national academic experts, we complemented it with primary research in 8 countries. As you can see from the map, they are also from lower and middle income countries, with the exception of Denmark. And as part of the research at the country level, we organized the participatory field research with over 1,000 people among children, family members, child protection professionals, as well as decision makers that take decisions about separation of a child from the family environment and then place the child into an alternative form of care. The overall research was framed around a socio-ecological model that allowed us to map out how violence and family separation risks occur and intersect across the different levels that Emily has illustrated. And we tried also to make comparisons across countries that could be relevant to inform policies, coming up with global recommendations for integrated child and social protection to prevent unnecessary child-family separation. Next slide, please. Again, next slide. So across all countries and listening to all research participants, we found a strong correlation regarding the drivers, and some common themes emerged equally from low, middle, and high income countries, of course, with geographical specificities like prevalence. Next slide. One key insight I want to share with you is that violence is strongly interconnected to the topic of child-family separation when it comes to the lived experiences of children with disabilities, because violence is a driver and it's also a consequence of separation. Before separation, children with disabilities endure physical and emotional abuse within the household, driven by discrimination and stigma, social isolation, and lack of family and community-based services. But then when they are separated, they are often placed in institutional forms of care. In many states, there is over-reliance on institutionalization, which is a harmful environment for children, and they are further exposed to violence, especially because many of these institutional care settings lack regulation and monitoring from the state. Next slide, please. A second insight I want to share with you is that there are some key issues around stigma and violence justified as care across familial and institutional settings. And these stigma and violence are underpinned by cultural norms that are internalized by caregivers across settings that equate harshness with good parenting and stigma as, for example, children with disabilities being a misfortune for a family. Also, there are some misperceptions around children with disability as less credible or able to report abuse, difficult, and therefore violent discipline is justified as necessary or corrective. So we have unfortunately documented practices like the restraint, over-medication, silencing in many countries of the study. We have also found critical system gaps and child protection decision-making failures. In most of the countries that we reviewed, the legal protections may be in place, but they are not enforced. And this is mainly because they are not properly operationalized. The implementation fails because of lack of coordination across the key sectors, education, health, social protection, that would help early risk detection. And this is due to, for example, lack of communication across sector, but also lack of sharing of data, lack of joint training, and the like. Also, of course, it contributes to implementation failures, the lack of funding and disability-specific indicators to track progress. On the other hand, we have also seen that gatekeeping systems are quite weak. For example, we have found in many countries that disability is the sole reason cited in reports about separation of a child from the family. That means that maybe the primary caregivers, the parents, were completely able to support the child with the right assistance and services, but the child was nevertheless taken out of the family and placed in an institution where there was the promise of accessing proper care, adapted care, and accessible education. Also, just to say that in terms of case management, we noticed that there are many gaps that put child protection professionals in a difficult situation: assessment tools, referral pathways, case management systems overall. They rarely integrate disability. If we move on to the next slide, I would just like to bring some light now by saying that, of course, we have identified across many countries, Indonesia, Lebanon, Kenya, Kyrgyzstan, Uruguay, positive practices. These include, for example, community-based MHPSS services that were effective in reducing institutionalization and harmful practices. Also, peer and caregiving support groups and training for residential education and health co-workers have strengthened disability rights awareness and also resort to non-violent forms of discipline. I can tell you many more, but for now, I think what the key message here is that these remain promising practices. Why promising? Well, because we lack longitudinal evaluations of impact of these measures. They remain mostly small scale, underfunded, and poorly integrated with a broader child protection and education system. So more longitudinal research is needed to understand what works in practice. Over.
Thank you, Claudia, and hello, everyone. I'm pleased to be able to contribute to this important discussion on how we can protect and support children with disabilities. As Claudia mentioned, I'll be focusing on our participatory and inclusive research methodology, and especially on how we developed an approach that enable meaningful participation for children with disability and what we learned from that process. This matters because too often children with disabilities are excluded of research, even when it concerns their own lives. Our project is strongly inspired by right-based thinking, particularly as outlined in CRC and CRPD, both conventions emphasizing children's right to be heard in all matters that affects them. These conventions form the foundation of our research. In addition, our approach is shaped by research on children's participation, disability studies, and, as Claudia mentioned, a socio-ecological perspective. And that helped us understand how children experience life across different relationships and settings, for instance, in schools, at home, etc. Together, we work with 517 children and young people across 8 countries. And our study, as Claudia mentioned, had a broader focus than violence. It explored the key factors contributing to child-parent separation. And as a part of this, we specifically included children from vulnerable families, including those at risk of separation and caregivers. So we adopted a participatory inclusive research design with strong safeguarding protocols to prevent harm and ensure informed consent. And ethical approval was obtained in all participating countries. Our guiding philosophy throughout the entire project has been children should not be adapted to research. We should adapt the research to the children. So in El Salvador and Lebanon, children actively helped us shape the research question that guided the study. So we can take the next slide, please. Yes. So together with these children, we developed these following 5 research questions. What makes children in a family happy when they are at home? What makes children in a family worried or unhappy when they are at home? And what makes adults in a family feel happy, strong, and united when they are at home? And what makes the adults in the family feel worried or unhappy when they are at home? And finally, what is needed to help families be strong and happy and united? But this co-creation didn't stop with these research questions. Through workshop, the children also helped develop participatory methods that would be used in other countries. So they designed these child-friendly and creative tools that supported both verbal and non-verbal expressions. As you see in this slide, this superhero drawings, story maps, but also problem solution trees. So on the slide, you can see a picture of a superhero, a girl from El Salvador drew. And talking about it, she said, 3 things that I could share that I would like to change, she said, are the lack of understanding, unity, and communication. My superpower would be to bring peace and harmony to families. When it came to the data collection among children with disability, I had the responsibility to try and further develop and adapt the workshop methodology to ensure that we could include these children. This meant adapting the tools and approaches that were originally designed for the typical children without disabilities. So we implemented this inclusive methodology in Denmark and in Indonesia, and in a modified version in Lebanon. You can change slide, please. Yes. But why is it so important to conduct disability inclusive research? Well, first and foremost, children with disability must be included in research. Their voices are not just valuable, they are essential if we want to truly understand how risk and protection play out in their lives. If we rely solely on adult perspective, we risk misrepresenting their experiences and overlooking critical aspects of their realities. So inclusive research, therefore, is not just a matter of good practice. It is a right-based imperative. Of course, conducting research on violence against children with disability brings a number of ethical and methodological challenges. These are not only due to the sensitivity of the topic, but also linked to the persistent assumptions about children with disabilities' ability to participate meaningfully in research. And it's precisely these assumptions that we need to challenge, both in how we design our method and in how we understand participation itself. So ethical research involving children with disability must ensure that their participation does not lead to re-traumatization, emotional distress, or negative consequences in their everyday life. In our study, we translated this ethical commitment into a methodological approach that focused on predictability, structure, and clarity. This was essential to make participation accessible and comfortable and as stress-free as possible for the children. So in practice, this meant obtaining informed consent from both the child and their caregivers, providing clear and age-appropriate information about the purpose, the process, and also the potential outcomes of the study, ensuring confidentiality and voluntary participation at all times in the process, and creating environments that were meaningful and dignifying, as well as both emotional and physically safe for the children. You could change slide, please. Yes. As I mentioned, my task was to adapt these creative and the participatory workshop methodology to make it accessible for the children with a range of disabilities. This included children with autism, intellectual disabilities, physical and hearing impairments, and complex support needs. So I developed a visual supported method, which I applied in 2 workshops in Denmark. And as mentioned, the colleagues in Indonesia and Lebanon also used this approach in their own settings. And I'll now try and take you through the process in Denmark. So the workshops were held during school hours in 2 special needs schools. And I recruited 10 children in the age from 11 to 16. And I worked very closely with their teachers. So they helped distribute consent forms to the parents, and they supported that the children in deciding if they wanted to take part in our study. So before the workshops, I had a close dialogue with the teachers to understand the individual needs of each of the children that had to participate in the workshop. So particularly in regard to communication and their support need during the workshop. I also sent out a visual overview of the project and the workshop schedule so they could introduce this to the children in advance. So that this helped to prepare the children and make the process more predictable and accessible for the children. So at the schools, I asked the teachers to reserve a calm and light and spacious room where the children could feel comfortable and safe. And inside the workshop room, I hang up these large visual schedules on the wall to structure the session. So at each step, I pointed to the pictograms that showed what we were doing, helping these children following along, and so they know what to expect. So the research questions were also supported visually. For example, when discussing what makes parents happy and united, we used a large poster showing a house with smiling adults. This helped make the question to be more concrete and accessible, especially for the children who benefit from visual communication. I allowed plenty of time for responses, recognizes that some children, particularly autistic children, may need a longer time to process and react. I simplified the wording of the research question and I adjusted my language throughout the match to match the need of the group. The children responded through speech and gestures and by interacting with the material. In the workshop, we did not explore personal experience of violence. Instead, we focused on everyday family life. So what makes children and parents feel happy or worried? Just change slide and I'll finish up in a minute. So the key findings from the workshops in Denmark, Indonesia, and Lebanon was that children felt happy in families when they had access to good family relations, sports, leisure activities, technologies, medias, and some of the themes you can see that I have written in the blue. What worried them was family conflict and instability, lack of privacy, but also financial uncertainties, etc. Overall, our study found that children with disability raised the same concerns and hopes as children without disability. So this confirms the validity and the value of their contribution. And it tells us that despite differences in ability, children fundamentally long for the same things, to be loved, to have friends, to feel safe, and to be heard. So children with disability are still too often excluded from research due to assumptions about their age, cognitive abilities, or communication challenges. Yet, with the right methodology, they can be included, and they should be included. So their participation is essential in research that shape policies and practices meant to protect them. To conclude, inclusive research is a moral responsibility and a methodological necessity. When we take inclusion seriously, we don't just do what's right, we produce better data, we gain deeper insight and create a fair and more effective policy for all children. Thank you so much. Over to you, Claudia.
So just to conclude briefly, I just want to recap and draw a summary of the key takeaways that can provoke some thoughts for the next sessions. The first thing that we learned, hopefully, in this presentation is that participatory and disability inclusive research is feasible and it's insightful. You gain data that you wouldn't get otherwise. Safeguarding and ethics must be embedded throughout the research stages. The research on violence should also look at the topic of child-family separation, because in the lived experiences of children with disabilities, these two topics intersect. Good participatory methods make research accountable to children, not just representative of their views, because you need to report their views in the research and make sure that you represent their experiences in the way that they want. And finally, we should really try to improve the way we adapt methods to children and not expect that children can fit into our methods. Thank you.
Thank you so much, Claudia and Cecile. And now we've had a message about the being unable to see some of the speakers or the interpreters. So let's just see if we can have that fixed before I pass over to Mariam. She will be discussing the integration of safeguarding within research. So just for my colleagues, is there anything we need to do to fix the presentation? So for the attendees, you can maybe check your view. So the way that you're viewing the speakers, where you can adjust it at your end. So you can choose the top right-hand corner of the Zoom screen and make the selection from there. If you're still having troubles, please do leave a message in the Q&A or chat. So I'm going to pass over to Mariam now. Thank you, Mariam.
Thank you, Lucy, and thank you for having me. Thank you, Claudia and Cecile, for your presentation. It's great here to be here with you all to talk about the importance of safeguarding. And we have heard from Claudia and Cecile how important it is to have safeguarding embedded in research right from the beginning. So I'm going to emphasize this in the 10 minutes that I will be here with you. Before I start talking about safeguarding, I would like to share the definition of safeguarding with you, the universal one by UNICEF, where it says like child safeguarding consists of frameworks and measures on conditions through which we limit the risk of children exposed to harm throughout our activities and throughout our programs by adult personnel and the organization itself. So this is not child protection, it's child safeguarding, and how do we ensure that the organization is safe throughout our research in this setting that we are talking about here today. So let's look at the scale of the problem. As we know, there are gaps when it comes to safeguarding and research. Not every research has considered safeguarding as a priority number one. And in many cases, safeguarding frameworks are heavily focused on service delivery. And this means the systems we put in place to protect children are tied more to care settings like schools, clinic, and community programs, rather than research environment and how we deliver research and how we undertake the research. So as a result of this, the research sometimes have gaps and limitations when it comes to safeguarding. And when we look at the serious issue, when we look at research actually being conducted, it's if we don't have strong protocols in place, we may end up causing harm. So going back to the definition, not by intention, unintentionally, if the protocols are not considered as a high priority number one throughout the research, we might cause harm or put the children at more risks throughout our research. And what's also concerning when it comes to safeguarding is to be treated, sometimes it's treated as part of the disability service alone. This means that researchers may not see it as their direct responsibility. And I hear this quite a lot from researchers, sometimes depending on the funding, lack of funding, they cannot have a safeguarding lead part of the research, and they need to start learning and being on board when it comes to safeguarding and what does it mean if they see any concern or they see any kind of report coming out of the research that they are delivering. So how do they deal with these concerns? How do they report it, and who is the person to report to? So these things are the protocols that sometimes are missing throughout the research delivery with children. And it's not just with children with disability. We're talking children in general, but we know that children with disabilities are at a higher risks because of their well-being as well. So the key takeaway here, and what I'm trying to say, is that the safeguarding must not be an afterthought. It should be right there from the beginning. So if we are putting the research program together and we are laying out the timeline, we need to ensure that safeguarding is there in every stage, in every level of the research, not just as ticking the box and saying research on safeguarding has been done, and we know what is the definition of safeguarding, and we know how to talk about safeguarding. So it's more about the delivery and if anything goes wrong. Next slide, please. So building on the previous point, there are several additional gaps in how safeguarding is approached in research. First of all, safeguarding risks are often missed during the risk assessment. So we all know that before any research, we look at the risk assessment, but sometimes safeguarding is not part of the risk assessment, and it can cause a big gap when it comes to understanding how safeguarding should be embedded within our program. And another challenge is children's participation is often limited. Of course, Claudia and Cecile were mentioning about the great research that involved children, but not every research will look into child participation with a greater depth. So that's another gap when it comes to safeguarding and having them involved rather than being told what to do. And another critical issue is when children are unprepared during the research. So children may reveal sensitive information about the cases of abuse that they have been going through. But if the researcher is not prepared in dealing with these disclosures and reporting pathways, then it can cause more harm and delaying the reports and not knowing what to do and what actions to take. And also, when we look at disability itself, it's also often treated as a topic in research rather than something that needs to be integrated into research design and safeguarding strategy. So this creates a disconnect, and we have seen that quite a lot when we talk about practice and research. There's a disconnect between the two. So we want to make sure that this doesn't happen throughout the research, and we want to make sure that these two are married together, they come together, and it's not just ticking the box and having it there as a homework, a to-do list, which comes at the end or at the beginning, but rather throughout the whole process. Without the right structures, we know that these gaps can be highlighted even more, and we need training and inclusive practices in place in order to reinforce the very vulnerabilities we are trying to solve, we are trying to support. If we can go to the next slide, please. So what can we do differently? I mean, we looked at the gaps, we looked at the challenges. What can we do differently to strengthen safeguarding and research? We need to move away from compliance-driven approaches to something more meaningful. We need to have it there right from the beginning, as I mentioned. I will keep repeating that because this is what we don't do usually throughout research. And first, when we move away from box-ticking ethics, we are ensuring that everybody at every level understands the importance of safeguarding. So not just the researchers, but when the researchers goes back to report about how the research has been, the ethics committees, they should be able to ask questions. They should be able to hold the researchers accountable and everybody else involved throughout the research when it comes to safeguarding the children. Researchers themselves needs to be prepared. So of course, that's great if they have safeguarding person in the committee, but it's also important to be prepared themselves and to be aware of the procedures and the protocols that it's embedded throughout the committee, ethics committee or the organization. And finally, we must build trust. This is the importance, throughout any research, throughout any works that we do for the children. We need to build trust. We need to be transparent. We need to be able to talk about how to empower them, not just having the children for the research, but what is it going to happen after that? How do we ensure safeguarding is not just taking information out, but rather having the children part of the process and the transparency of the child participation? Next slide, please. So here I have put a few points in terms of moving forwards, which I clarify that governance and accountability is very important in how to ensure that we train ethics board on disability and not inclusive safeguarding. And we need to make sure that the children are at the center of everything we do in terms of research design, in terms of the delivery of the research, and also about their dignity and how to ensure that they are part of everything that we are doing. And promoting safeguarding audits, that's a great way to see if we are doing the safeguarding that we have agreed and signed up. So not just doing the training, not just signing the child safeguarding policy, but rather going through the audits and looking into what are the gaps, what can we do different. Sometimes throughout the research, things might change. So we need to be able to adapt to these things and have it part of the M&E as well to track the real impact. And include child safety in research success measures, which will be really helpful when it comes to understanding safeguarding if it's been embedded successfully. And as a conclusion, next slide, please. In closing, we have a responsibility, not just as researchers, but as human beings, to ensure that our work does no harm to children, especially when we are engaging with children with disability. And we have looked at the current gaps and the weaknesses, and then also we understand that sometimes safeguarding has to come from the high top of the board or the ethics committee. But us as researchers, as people who are delivering the service, sometimes we have to make the things that are important to us rather than waiting for someone to check on how we deliver and design the research. So the responsibility at the end of the day lies with us. And it's more important to ensure that strong safeguarding strengthens research quality at the end. And it's not something added as a thing like a homework, but rather for us to understand that if we have safeguarding in place, we can ensure that the research is more successful. Thank you very much.
Great. Thank you so much, Mariam, for those reflections and conclusions that you have shared with us there. Thank you, everybody, for your patience with the technical issue we were just having with trying to make sure that everybody could view the sign interpreter. So we've just been working on making sure that that will appear. So thank you for your patience on that. And what we will have now is our second audience poll. So you should have a pop-up come for audience poll number 2. And this poll is asking you, in your experience, which sector plays the most critical role in safeguarding children with disabilities? Then you'll be able to select one of the options, and those options are education, justice, health, social services, or all equally. So we'll give you a minute to respond to that. Thank you for participating. So the poll should just show up for you there. Okay, so it seems we might be having a problem with the poll. So let's see if we can have it show up. Thank you. Okay, so it seems that we're still seeing poll number 1 instead of poll number 2. So thank you so much. I think it should be coming up now. So audience poll number 2, in your experience, which sector plays the most critical role in safeguarding children with disabilities? So you can choose education, justice, health, social service, or all equally. So we'll give you just a minute to answer that poll. And the thing that we will be getting to next after this poll is the panel discussion with all of our panelists. So I'll give everyone another minute to get their responses in, and then we will move to the panel discussion. So let's see what we have for the results of our poll. So we have 63% of you said that all of these sectors play equal roles. So really significant majority of everyone is saying it's all equally. And then we have about 18% of people said education was the most critical role, the sector with the most critical role, followed by social services. 13% of you said that. Then justice, we had 5%, and we didn't have anybody for health. So it looks like we're all leaning towards all equally. So thank you so much for participating in the poll. And we're going to be moving into the moderated discussion with our speakers now, focusing on the challenges and barriers to conducting research on the topic of preventing and protecting children with disabilities from all forms of violence and abuse. So I'll have all of our speakers turn on their cameras and get ready for the panel discussion. So I'll be asking a few questions and directing it at specific speakers. And then, of course, our speakers can also come in to add a bit more if there's something else that they want to share. Also, the Q&A box is there and open. So if something catches your attention during this that you want to ask a follow-up question to, please do include that. Please do add that to the Q&A. So I'm going to start with a pretty broad question, and that's what are the key ethical and methodological challenges in collecting reliable data relating to violence against children with disabilities? And Cecile, I'll hand to you for discussing this question.
Thank you very much, Lucy. I think I'll touch upon some of the things that Miriam also raised in her presentation. But first, I would like to say that collecting reliable data on violence against children with disability present these several intervened ethical and methodological changes. So ethically, the primary concern is the potential for re-traumatization, which I also touched upon in my presentation. Children with disability, especially those with communications or cognitive impairments, may find it difficult to articulate distressed experiences, and researchers therefore must be attentive to avoid causing harm. So ensuring, for instance, informed consent is particularly complex, but what researchers could make use of was to work with an ethical sensitivity, you could say. So that we always work with that these children often face a multiple layer of vulnerability that would be both socially and physically and systemic, and that we constantly are aware of the ethical implication of our work throughout the process of the research, as Miriam also touched upon. So ongoing ethical sensitivity means being attuned to a power imbalance, listening carefully all the time to the children's voices, especially when they communicate differently, and then always and continuously reflecting upon our methods, our interpretation, and how we interact, and how this might impact their dignity, but also, of course, their safety.
Great. Wonderful. Thank you, Cecile, for that.
Okay.
And I think this kind of leads me into another question that we have, which is about how do attitudes and stigma impact research approaches, reporting, and findings? So Claudia, I'll hand to you for that question.
Thank you, Lucy. This is a very important question, although probably I run the risk of stating the obvious, but what they do is basically to distort the picture that we then capture about the realities that children with disabilities face. In our global report, in the field work in the different countries, we have found that many national data systems fail to systematically identify children with disabilities. And even when data are disaggregated by disability, the type of questions that are used fail to capture the complexity of their experiences. Therefore, it's important to involve them in the right way, because it's not just an ethical, moral imperative or a rights-based approach, is also that it can really enrich our knowledge by collecting data that is informative. Otherwise, we run the risk of ending up with a false narrative about their protection needs, which of course undermines not only the research results, but also the planning of and the delivery of the services that they need to improve their lives.
Yeah, absolutely. Thank you so much for those perspectives. And I think that you know, what you have outlined is certainly really important to consider and to think about how we can, integrate this kind of understanding into the work and research that we're doing. So my next question here is for Emily, which is about research tools. So do we think that current research tools for measuring and documenting violence prevalence and safeguarding interventions for children, do we think that these current research tools are disability inclusive?
Thank you for the question. So I guess before thinking about the tools themselves, disability inclusion starts with your data collection procedures and your research questions, and what a lot of our speakers have talked about today is how you can adapt and make these more accessible. So that's the first thing. But then thinking about the tools themselves, so measuring prevalence, the gold standard way to measure prevalence in a quantitative survey is to ask about different acts of violence, right? However, these different acts of violence in a lot of the international tools might not be capturing all of the experiences of violence that children with disabilities experience. So Claudia talked about over-medication, for example, and that might not necessarily be captured in these current tools. So more data is needed to explore these measurements and whether we're capturing the experiences fully. And then when we think about interventions, again, children with disabilities might actually be included in a lot of interventions already. So in schools, for example, children with disabilities go to schools and they might be included in the sample, but they're often not explicitly measured. And then subgroup analyses aren't conducted. So disability inclusion starts with the methods and the measurement. And then also, just to add that, interventions might not be necessarily disability inclusive if they're not targeting the drivers of violence against children with disabilities, which comes back to my point about measurement. So I'll hand back to you, Lucy.
Wonderful. Thank you so much, Emily. That's again, really important reflections there, and thinking about the current research tools and thinking about prevalence. Of course, we want to have prevalence studies, and this is very important, but we also want to, our research and evidence building to be going beyond prevalence studies and to also understand the systemic causes and intervention effectiveness. So Mariam, I was wondering if you had some suggestions to this topic. How can research move to understand systemic causes and effectiveness of interventions? Over to you, Mariam.
Yes, thank you, Lucy. Just like what you just said, that it's prevalence studies are really useful because they do tell us the big problem, the big picture of how many children are affected and how often something is happening, but they don't tell us the real story. I mean, sometimes this is what's lacking in research. We need to understand what's happening in the families and in schools and communities. And I really like the question in the poll where it's trying to understand who is responsible for safeguarding. So similarly here, when we are trying to understand better a research topic, we need to look at the underlying reasons. What is it going behind the scene? What is the law is telling us? What policies are in place? And what are the organization or the programs that they are creating solution? Are they working? Are they not working? Do we need to change things? And unfortunately, sometimes, I mean, I don't want to be negative about it, but we get so fixated in how we do things, and it's difficult to unlearn, to learn new ways. So answering your question, I would say we need to understand more than just what is the picture and how many children are being abused. We need to understand the more behind the scene. Yeah.
Right, absolutely, Mariam. I think that's really well put. Absolutely important to understand more of what's happening behind the scenes and what is really occurring for children with disabilities. And I mean, I have a few other questions, for all of our panelists, and I think I'm going to go back a step to kind of start from the beginning, if you will, in the surveys that we use in research, and thinking about, we talked a bit about the impact of these research tools and surveys, and how exclusion from these methods can lead to exclusion in the evidence that we gather. So I think the question I have for Claudia is, it's kind of two parts. There is underreporting, stigma and exclusion from surveys. So, when this occurs, how does that impact the research findings? And is it a given that this kind of underreporting and exclusion from surveys will always occur? So what are your thoughts on that, Claudia?
Let me start maybe from the second question about exclusion from survey and whether this can be overcome. It's widespread, but yes, you can change this. If you start thinking that inclusion, I would just build on what Emily said. She said inclusion starts from the methodology. I'm a policy advisor, and I will tell you inclusion starts from systems, because if the system is biased, it basically makes us all internalize the bias. So for example, if I'm gonna ask a child with a disability a number of questions, if the child has been exposed to a community or a society, even on TV, where the views of children with disabilities are diminished, then he will fear blame, he will fear not to be believed. Or if it's a country where there is over-reliance on institutionalization for children with disability, maybe the child is going to say, oh, I'm not going to disclose certain type of information because then I run into the risk of being separated from my family and then institutionalized, and I don't want that. So I think that also the systemic bias influences research, indirectly, but also directly by shaping the way research participants perceive themselves and the environment they live in. At the same time, I think that this bias run the risk to being built also in the researchers themselves. So very often when we do research on children with disabilities, we take a deficit-based view on them rather than a strengths-based. And what happens is that basically we tend to design questions in a certain way. Yeah. So all this stigma that you also mentioned, the attitudes that both the researcher and the research participants have, definitely hinder the quality and the robustness of the research. Just to mention that we were aware of this problem when we did the research for the Global Report on Children's Care and Protection. And one solution that we found, although I hope it mitigated the risk. The risk is always there, but let's say one solution we tried to adopt was to co-create the questions, co-design the research questions, co-design the methodology, how to ask the questions to the children, and even the child-friendly tools were co-designed with the children. So this way we try to minimize our own bias and the bias that society carries on research.
Great. Thank you so much. I think you've raised a lot of important points there. And, your discussion of stigma and the way that it affects the children themselves, so some internalized stigma, and also the how it impacts the researchers themselves, and including in unconscious bias. I think this is very important. And if we think back to our first poll, where we asked about what are the big barriers and challenges for research on children with disabilities in this topic, I think the majority of our attendees answered that stigma was a major challenge and barrier. So I think we're really seeing that reflected here, the role of stigma and discrimination and how that influences our researchers and the children that we're working with and the services and the way that this research and evidence is brought into the real world and into the programs that we do. So I do have a couple more questions, but I do want to give a moment. We've already kind of covered quite a few things here. So I wanted to give a moment to our panelists, if there's anything that they wanted to add on any of the questions that we have done so far. So you can feel free to open your mic and add something if there's anything you want to add on the things that we've already discussed.
Mm-hmm. If I may, I'll just would like to continue a bit about the methodological aspects of it. And I think one thing that we really have to be aware of is that we have to there's no one size fits all when it comes to methodology. We really have to look at the unique child that we have to interact with, whose perspective that we are interested in, and then we will have to adapt our way of speaking, being, interacting to that specific child. And that was also what we did in this study, but also what I've had great success with in other studies. So and especially when we interact with children with learning disability or intellectual disabilities who might not have a strong verbal language, we really, of course, have to try and meet them where they are communication-wise.
Absolutely. I think it's still very important. Would any of our other panelists like to offer some reflections on these questions so far? Please come in. That's okay. We have plenty of time for further discussion, and a couple of other questions that I have for this discussion is about the issue on conducting longitudinal studies. So for longitudinal studies on the impact of violence and prevention measures, so what challenges do you think that we see in conducting such studies, and some of the ways that maybe we can be addressing those challenges? So Claudia, I'll pass to you for this question.
Thanks, Lucy. You're touching upon a pain point, I would say, because longitudinal studies are extremely important to understand what works and what doesn't to support children with disabilities. However, they're still underdeveloped. And in my view, there is one main challenge, that is the lack of sustained funding, because most of the research projects tend to be short-term, and in longitudinal studies you really need to follow up on a cohort for a long period of time. So securing that constant sustainable funding is nowadays quite hard. This also how to say, brings another challenge that especially in lower and middle income countries, you will struggle to find researchers, local researchers that conduct local research and longitudinal studies because of the lack of funding. At the same time, when you find the longitudinal studies that are indeed implemented in lower middle income countries, if you observe, they will be carried out by researchers based somewhere in high income countries. So there is a sort of bias then in the body of evidence as per who is generating the data and the interpretation and the framing of the narrative around the data. So I think this is a major issue. Another challenge that comes to mind from a technical perspective, especially when we think about longitudinal studies involving children with disabilities, is that you need to follow up with your research group for many, many years. And children, what do? Children grow up. They grow up and they move on, and then they have their own individual trajectories, and you need to be flexible enough and have flexible tools and methodologies to adapt to these constant changes in their lives, as well as in changes, adapt to and capture changes in the system that then in turn intersect with the individual trajectories of children with disabilities. So it's also from a conceptual and methodological perspective, a difficult endeavor. It's not impossible. It just needs proper resourcing and preparation.
Absolutely. Difficult, but not impossible, I think is certainly the way to to explain so many of the challenges that we face in research and evidence building on this topic for children with disabilities. And I think you've raised some very important points there about the other types of bias that come into research on this topic, not just the bias based on stigma and discrimination related to disability, but also the bias of where research is taking place, who is carrying out the research, who is interpreting those results. And absolutely, we do see often a greater proportion of studies and research coming from higher income countries, coming from the global north, and less coming from lower and middle income countries and from the global south. And that, of course, can really influence the results that we are getting and the kind of information that we can use as well. Because if we're not hearing from those countries and those researchers, then we're not going to have a full picture of the research. I would also say that, your point about thinking about how children are growing up and children have their own individual trajectories and things change over time. This brings me to think about the kind of ethical considerations involved in research on violence against children with disabilities, not just for longitudinal studies, but all kinds of studies. So I think we have touched on this a bit already, but I would really like to hear perhaps from Emily first about some of the ethical considerations we need to be conscious of in this kind of research. Over to you, Emily.
Thank you. And absolutely. So I think when we're asking about violence, there's a lot of ethical considerations that apply to all children, children with and without disabilities. But I think there's some additional important considerations that I think have been touched on throughout the presentations earlier. So I think when you're actually conducting data collection, there's so many different things that need to be adapted. True assent from the child with a disability, and also parental consent needs to be provided, and consent and assent forms will need to be very carefully adapted for particular impairments to ensure that true consent is given. And I spoke earlier about referral structures and how there needs to be a clear pathway to referring cases of disclosures of violence that are disability inclusive. And if this is not possible, if a child with a disability discloses that they've experienced violence and you're not able to give them a service such as counselling or support to a hospital in urgent cases or to a social worker, then there should be a real consideration about whether the research should go ahead. And I'll hand back to you for others' reflections.
Great. Thank you so much, Emily, for that. Are there any other comments from the panelists on this, on the ethical considerations in research? Please do feel free to come in, Mariam, Claudia, or Cecile. Mariam, come in.
I can just add, like, to Emily's point. So it goes back to, again, safeguarding, and being able to understand what do we do if things go wrong throughout the research. And what Claudia said as well, lack of funding, this comes in every setting, in every NGO or organization. Sometimes we have to take out things that we think they are not important, such as safeguarding, which is a big mistake, because taking safeguarding out of the picture and not having it monitored and holding people accountable can break the image of the whole research and the department and the organization. So it's very important when we are allocating funding, we have to put a bit of funding there for safeguarding. If not the funding, we have to ensure that the researcher is equipped with the right resources, tools, and knows exactly, as Emily said, who to go to and who to ask help for. Sometimes they don't have to do everything themselves. So it's like, how do we ensure the safeguarding lens is always there in every step that we are taking as a researcher?
Absolutely. Very important, Mariam, this point on safeguarding. And yes, as you said, it really impacts the whole research. It impacts the research trajectory, results, and then, of course, the children and families involved in the research. So it is absolutely vital that we're considering that in research design. Any reflections, Claudia or Cecile, on this ethical consideration?
If I may just make a brief comment. What was very helpful in our research experience was to have also staff that is specifically devoted to safeguarding. I know this is expensive, but sometimes it can be an educator or a trained teacher that already knows the children and that is being prepared, briefed to make sure that the process flows in the right way and knows what to do if something goes wrong. Because sometimes when you are doing research, you have your hands full, to be honest. And so it's always good to collaborate with people, especially people that are reliable and trusted figures for the children, that they can also take an active role in the research. Even better, of course, if you have a bit more money to have a safeguarding specialist, but training can also go a long way.
Great. Thank you so much, Claudia. Cecile?
Yeah, I just wanted to add to your point, Claudia, and I think one of the key takeaways is really that we always need to collaborate very, very closely with the professionals or some safety adults around the children. And we did it in this study, and I've also been doing that in other studies. And also just in order to make sure that the child is truly included, and that we match our way of including them in the research to the child. So what we did in this study was actually, it was really a close collaboration with the educators and the teachers. And that was long before we even did the workshops. We had many conversations, many emails. We emailed the materials back and forth. Is this wording? Do they understand this wording? Is worried? Is it a too difficult word? Could we phrase it in another way? And how can we include the children which are participating in the workshop? Is there somebody that we have to take special considerations about, and all these things? And I really don't think that we can do studies in this area with children with disability without professionals or adults who knows the children very well. If we have to be ethical, and if we have to also really be able to catch the children's perspective on what we want to have from them, we really need to do it in very close collaborations. And I've just been doing a study with some younger adults, all the way up to 30 and 40 with intellectual disabilities. And what I offered them was, of course, that to the interviews we did photo voice interviews, which is also a very nice creative method for this target group. And what I offered them was that when we had these sessions, that they could bring somebody that they feel safe with, and all of them chose that because it just really made them more secure, and it was a really nice session. And maybe researchers also need to be a bit more brave. It doesn't matter that there's somebody extra in the room. It's fine. You can have a really nice dynamic, and the children or the young people will feel more comfortable about it. And we will enable them to really bring what they want to the table.
Absolutely. I think that's a really important point there. The how the participation of children and young people with disabilities, is carried out, and having the flexibility to accommodate and adapt the way that you're doing things to make sure that that we are reaching these children and really including them in a in a meaningful way. And for my final question, I'll be moving to Miriam, and kind of changing tact a bit here and thinking about where we feel research should be heading, right? So how can we, when you think about the research, how can we have research on systemic causes and intervention effectiveness? Now, from what we've heard from some of our discussions so far and from the presentations, is that often the research on the systemic causes of violence and abuse and interventions effectiveness is missing. So do you feel that is a given, or where can this research be heading? Over to you.
Thank you. So I would say, I mean, in terms of what's missing and limited, it would be about how, I mean, we all talked about how many children are affected and what are they affected by. But then again, going to the previous question where I answered, it's also about thinking of lack of system. So we need more research on that. We need to understand what is it happening around those policies and the services and the poverty and sometimes discrimination and the social attitude. So there is a whole things that we need to focus on. And I think this is the biggest gap, where we sometimes focus only on involving the children throughout participation and understanding children with disabilities throughout the research, but then we don't look at the behind the scene, as I mentioned in the earlier question as well. And also what's important is, like, we have to understand we don't have enough evidence about which intervention works for different groups of children, depending on the age, the gender and disability, and also the region. So if there is, as we mentioned earlier, there is a lack of connectivity with researchers in different countries where we are not reaching out to them, there will be a gap of understanding the data out there. So we need to really look at it as more holistic, and how can we get more research around the different areas and different regions to better understand the missing voices on the research that we're trying to achieve.
Yes, absolutely. Thank you so much, Mariam, for that. Yes, I think, as you've outlined and as we've talked about in this panel, there is a lot happening behind the scenes, as you said. So I'm going to wrap up this part here. And thank you so much to all of our panelists for addressing these questions that are really quite broad and really range across quite a lot of things. And now, as we go to move on to our question and answer discussion session, we do have another poll for our attendees. So thank you to those who are here, still here joining us and ready to participate in the poll. So this is audience poll number 3. And the question is, how do stigma and negative societal attitudes most impact research outcomes? And our choices are: lead to underreporting, influence research design and sampling, skew interpretation of findings, or all of the above. So please do choose your answer for that. You've got 3 options and then the all of the above option. Also, we'll take this opportunity to remind you that our attendees, that we do have the question and answer option in this Zoom, so you can submit any questions that you have, whether it's about the presentations that were done or any of the other any of the other comments that were made during the panel discussion, or really any sort of question on this topic that you're thinking about. Now, I'll give you the audience poll answers, and we do have an overwhelming majority here answering all of the above. So we're saying that it's the impact is leading to underreporting, influencing research design and sampling, and skewing interpretation of findings. So it really seems like we have quite a lot of agreement on that. So I think we will now go into our final session, welcoming questions from our attendees. And you can direct your question to one or more of the panelists, or I can open it up for everyone to answer. So I see that we already have a few questions in the question and answer. So I'm going to start with 2 of the questions that we have, and then I'll open it up to our panelists to discuss further. And I think we have about 20 to 25 minutes for this one. So I'm going to start with the first question, which is, do assistive devices play a key role in including children with disabilities in research and surveys? And how does it impact the participatory approach? So I might go, if any of our panelists want to answer that, or I can come to you each individually. Perhaps I'll start with who is on my screen first. So that is Cecile, and then Mariam, then Claudia, then Emily. So please do come in. Cecile.
Thank you. I do think, of course, I mean, like if it's needed, assisted devices in being able to participate in the study, of course, the researcher should make effort to make those available in order for the child to participate. Yeah, I think I can't see I can't see why we shouldn't. I mean,
Yeah.
like from my perspective, I do think that we should do everything we can in order to include children with disability in our research, and that means if it's making creative tools that they can use, if it's being in places where they're particularly comfortable, if it's coming to the child instead of thinking you can come to our office, and all of these things that can hinder participation, we should try and clear out of the way. And what is really key, I think, is that we also have to realize, and it comes back to a bit about the discussion earlier on about the lack of funding. So we also need to have time to do this in our research project. So we also have to accept that when we do research with children with disability, it might be a bit more time consuming. And that means that we might have a smaller groups of children that we can involve, because we have to attend to in certain ways in order for them to participate. And I think that is also a part of the dialogue that we also have to make clear for the funders, for instance, that what is possible if we need to do ethical research with these groups of children in order to gain their perspective on things. So I really do think that we should do anything we can in order to meet the child.
Right, absolutely. I have, I think, Mariam and then
Yes.
Claudia.
So I agree with Cecilia. I mean, if we can afford having them, they are not just helpful, they are necessary. They are very essential in order for us to get their voices out there and make sure that nobody is missing out in their experience during the research. So if we can have them, it would be great because they will help to be inclusive and more participatory by the children.
Great. Absolutely. Thank you so much, Mariam. Claudia and then Emily, any thoughts on this question?
So when I think about assistive devices like, for example, hearing devices or communication boards, what do? They basically level the playing field for those children who have barriers in communication. And this goes back to what we discussed in our presentation as well. You need to adapt the research to meet the communications needs of children with disabilities. So therefore, certainly they are important because they basically allow not only to give access to children to the research, but also they allow them to express themselves better. And so you get better data, better information. It's not just about bringing more children into the research project, is also about the quality of what you get out of it. At the same time, we shouldn't forget that a device is a great support tool, but it works only if the way it's used, again, follows the safeguarding and the ethical guidelines. So without those in place, you can use these devices, but you will not have good research anyways.
Absolutely. Very well said. Really communicating in the way that best works for children with disabilities is absolutely essential. Emily, any thoughts from you? And then I'll go to the next question.
Thanks. Yeah, and I totally agree with what others have said. So I'll just quickly add that before starting research and with children with disabilities, it's important to ask them, to ask their caregivers, what are some of the adaptations needed for me to conduct this research well and to make you feel comfortable. And that might be that there's an assistive device that's used and that should be part and considered in the research. So I just wanted to add that.
Absolutely. Thank you, Emily. So thank you for all of that. And it seems like we are all on the same page here with doing everything we can to meet whatever it is that will make the participation, the full participation in research, possible and meaningful for children with disabilities, and making sure we meet them where they are at and whatever support needs and accessibility needs they have. So we have a few more questions from our attendees. So the next question that I'll ask is in talking about low resource settings. So in low resource settings, what is the best path to move from research to action? And what can we as researchers do to motivate policymakers and build political will for that action? I will open it up to the panelists. Please unmute and add your comments there. Thank you.
I will start because I feel compelled to, as I'm a policy expert, and that's mainly my job all the time. Like, how am I going to persuade policymakers that this research piece is important, or actually that the findings should actually guide the design, the development, the implementation of the policies? That's something I'm grappling around all the time. So I think in low resource settings, a very smart way to go about it is to partner, partnerships with any anybody that is like-minded and look across sectors. Again, sometimes we get very entrenched in our silos, in the civil society community or the, I don't know, intergovernmental organizations community, or in one sector, education sector, disability. But where are the bridges? Where are the bridges? For example, my organization works for children who have lost parental care or risk losing parental care. I wouldn't define it as a disability rights organization, but it so happens that many of the children in our target group are children with disabilities, because as I presented before, disability can be a driver of a separation, and what we don't want to have is that. So why not to partner with disability rights organization, with service provider across education system, child protection system, and together form that critical mass that then will exert a certain pressure and provide a certain credibility and attention before policymakers. So that is in a nutshell. I will stop here. I can elaborate more, but I want to give opportunity to others to respond.
Thank you, Claudia. Other panelists, please do go ahead and share your thoughts.
I think also, I mean, through the works that we have done with different countries, is using the champions out there and the networks that exist already. So we can identify who is the community leader if we're working with faith communities, for example, if we're working with different tribes. So it's identifying who are the influential people out there and support them with the data that we already have to advocate for the action. So I like what Claudia was saying as well. It's like we have to make it simple. We have to make it in a way that we are trying to influence, but in a different way. So using the resources that is already there, rather than just thinking about the gaps and how can we create more research and studies in the region.
Yeah, and if I could continue and add to the great points that both Claudia and Marian just came with. I also think that it's really good if we can invite the partners in very early in the research process, because they also know from their perspective what is needed in order to help these children. So if we can invite them on early, and we can do some kind of action research, so they also are contributing in developing research question. What should we even look at? What are the problems, and how should we go about them? I think that would also be important.
Absolutely. Any thoughts from you, Emily?
I think this is a part that I'm still trying to figure out. How can you do this that's actually meaningful and actually long-lasting? It's a tricky puzzle, but I'd say, I guess, as starter, as a researcher, that we need more evidence so we can come to policymakers and say, this is why it's so important.
Yes, absolutely. And I've seen that we have a comment in the question answer box, sharing from one of our attendees that in their context of the Guma refugee camp, that there's more than 14 nationalities with different cultures, and they're having this strategy of organizing a lot of different focus groups, discussions, awareness campaigns, organizing forums and meetings. And I think that is, a really practical example. Thank you, Julius, for, exactly what we're talking about, reaching out to the networks that exist, trying every possible avenue so that we can really be including people and reaching all of the possible partners and stakeholders and people engaging. So I've got a couple more questions, and we have just a few more minutes left in this section. So I'll go with the question we have about how are children prepared for research and data collection? So perhaps this is for some of the studies that our panelists have shared. How were children prepared for research and data collection? Let me open the floor to our panelists.
I can start by just giving a practical example from my own research. I mentioned in my earlier presentation how we developed letters to the children with drawings and things which were easy and accessible, which the teachers could go through with the children to inform them about the research. But I also did videos. So I would send videos to the children in order for them to see who is this strange researchers that want to be in contact with me, and just really try and just explain the research for them. So I think that could be one way, but I really do think it is important to prepare them before, and just not just show up and just ask for their contribution in the spot. But I mean, like, they need to know about the research purpose and the research in good times and have time to think. So like some of the young people that I'm working with right now with intellectual disability, I think, I mean, like, the process has been that maybe there's a month where they will go and talk to their care professionals with whom they live, and they talk back and forth, and they'll see how they're feeling, and do they want to do it. So I would also just say that you should put good time into preparing these children. Yeah.
Absolutely, very important to have this preparation. Open it to any of our other panelists to answer this question, and then I have one more final question from the attendees.
So maybe I can go next to quickly share how we did it in the global study on children's care and protection. First of all, one approach that we used was to pilot the methodology. So we co-designed it in 2 countries, in Lebanon and El Salvador. And then we piloted it. And by doing that, basically it was a learning journey for the children and for the researchers that also helped to build in trust and confidence in the methodology. And then this methodology was adapted and replicated in the other countries. And I think the approach is good, because you basically have your trial opportunity and you see how it goes with the children. Maybe ideally, 2 different contexts like this one, El Salvador and Lebanon, with very different cultural and societal issues, can offer you a certain variety, and you can observe and test before you actually implement it throughout the research.
Great, thank you so much. So we are running out of time here. We did have one final question about experiences of being a researcher with disabilities themselves, and this person sharing their experience of exclusion from the actual substantive field-based activities of the research process. So I'm going to, because we're out of time here, I'm going to leave this question in the Q&A box for our panelists to answer via chat, because I think this is a really important dimension of research. It's not just about the research of children with disabilities, but also the experiences of researchers with disabilities themselves. So thank you everyone for your attendees' questions. And I think we do have perhaps one last poll, if I am correct. Yes, and the audience poll here is: which of the following is the biggest challenge in conducting participatory research with children with disabilities? And we can choose ethical concerns, lack of funding, limited research capacity, or difficulty accessing participants. So please do add your answers to the poll there, and then we will be moving into the final wrap up of everything. And I will just say that I think the panel discussion and question and answer was really quite diverse, and we really covered quite a lot of things. And it's really great to hear from our panelists and from our attendees some really similar priorities about including children with disabilities, about participation, about accessibility, and about trying to reach out and involve everyone and direct it towards action to prevent and protect children with disabilities from violence and abuse. So thank you for participating in the panel there. And it looks like we have almost half of the poll is saying that difficulty accessing participants was the major challenge, followed by limited research capacity, ethical concerns, and then lack of funding. Thank you so much, attendees, for sharing that. And we'll now be transitioning into our close of this session and close of the webinar. So I'd really like to say thank you to all of our participants for joining us today. And of course, thank you so much to our panelists for taking the time, sharing your expertise and your thoughts on these important considerations. And I think today's discussions have really reaffirmed the importance of building stronger, more inclusive research that places children with disabilities and their families right at the center. And of course, I'll also take the opportunity to remind you that today's session is part of a wider effort to examine and address the barriers that continue to shape research in this field. And so when you're reflecting on today's discussion, I hope that we can, everyone can recall a lot of the things that we talked about how we can strengthen research practices and promote greater inclusion moving forward. So I'm now going to hand over to Gavin for the closing remarks. Thank you.
Thank you so much, Lucy and everyone. This has been an extraordinary conversation, so much to talk about. I think, we started off identifying that children with disabilities are likely to experience twice as much violence as their peers, greater risk to those with cognitive and mental health disabilities. But yet these experiences go underreported due to many structural barriers. We heard about some of these systemic stigma. I think this is a really interesting piece and reflection, cultural attitudes and institutional over-reliance on how children engage with research, and also to the last point, the last question that's being answered, where researchers themselves are facing these systemic biases and precluded from being researchers. So I really appreciate that last question, and much to do. I think the thing that came out very strongly is safeguarding and ethical standards are non-negotiable foundations of research. So if safeguarding mechanisms cannot be ensured, the research really must not go ahead. These protections are not optional. They're the starting point. And we heard ways in which ethics can be embedded through this process. And I invite you to join a session coming up in this series where we're talking specifically on ethics, where some of these things will be further unpacked. And of course, funding came up. Longitudinal research is essential, but structurally underfunded. And they're vital if we're going to measure impact and inform effective policies. But sustained funding is rare. It's becoming increasingly rare, particularly in low and middle income countries, limiting opportunities for local researchers and leading to fragmented evidence. So in all these points, I just wanted to point out that recently we launched a global research agenda for children with disabilities that was launched at the Global Disability Summit. The link is in the webinar chat now, so you'll be able to see that. And it highlights some of these issues. We'd love you to take a look at that and get back in touch. And I think, gosh, there's so much you talked about that was so interesting. I can't at all do it justice at this time. But before I close, I just want to extend my sincere thanks to Lucy Richardson for moderating today's session, and to our speakers, Emily Eldred, Mariam Asani, Cecile Mosby Jensen, and Claudia Arisi, for your time and for such an engaging and thought-provoking conversation. Clearly, we're on a journey here, and we need to continue this together with you. So thank you to everyone who tuned in and shared your questions. If we've not answered your questions, we will try, and we will do that together. Let's move forward together and invite you to continue this journey with us. And if while watching, that you had lots of things to say and you just didn't have the opportunity, and you want to share or contribute research that you've been doing, or you have answers to the questions that were raised, examples where you've done research that exemplifies participation and ethical participation and safeguarding with children on this topic, we would love to hear from you. So please reach out. and maybe we can also amplify your work in some ways to put it out there on a bigger stage, so we can all learn together and shape and also perhaps shape future sessions. So any ideas for more sessions like this, topics, do get in touch. Just to say, our next webinar takes place 30th of April, where we'll be exploring the topic of assistive technologies. It will be moderated by and this will include Fernando Botelho, Israel Balogun, and Paul Lynch. And we really look forward to welcoming many of you back there. The link has been put back up again. If you've not registered, please go ahead and register for those sessions. Finally, just to thank everyone for joining, in particular to Altamont Group for their excellent support in curating and facilitating today's sessions. I hope we quickly resolve the issues of the signing and that was properly spotlighted quickly, but apologies if that caused any inconvenience, and we thank you for your patience. And last, to overseas interpreting, to Oliver and to Zhao for providing the international sign interpretation throughout today. A huge thanks. So from us all here, until next time, thank you so much, and goodbye.